I'm going to have the panelists go ahead and introduce themselves. We're starting with Jillian Broce. Okay.
Okay, 1 second, Jillian.
All right, thank you. So my name is Jillian Broce. I'm with the Weld County Area Agency on Aging. I don't know if everybody knows where that is. We're in Weld County, Colorado, east kind of in the Colorado region there. Can you guys go to the next slide, please? So Weld County is kind of unique. Our area agency on aging serves one county, just the entire Weld County region. It's about 4,000 square miles. So that's about 3 times bigger than the state of Rhode Island, to give you some perspective of the geographical size. But it includes some unique areas, so some frontier land, some rural regions, as well as some urban areas. We have just over 300,000 folks living in our county. Just over 12% of them are 65 or older. Around 9% are living kind of below that federal poverty level. And the median household income is about 74,000. Go to the next slide, please. Yeah, so our voucher program consists of Older American Act funding. So we have about 100,000 federal funds, as well as 15,000 kind of state general funds, giving us about 115,000 to use on our Consumer Directed Voucher program. Staff-wise, working on this program, it's me, a one-time part-time employee. I have worked both with the single entry point or our Medicaid case management for a few years, as well as 11 years working as this specific program, voucher program coordinator. So right now in our current state fiscal year, we have currently 55 caregivers enrolled in our voucher program, though we will serve about 86 caregivers throughout the total fiscal year. And this is a good general average of about how many people we serve in a given year. Right now, the average age of our caregiver is 68 years, and the care recipient is 78 years. Go to the next slide, please. So our program is a reimbursement only program. It starts with a referral. Those can come from a number of entities outside agencies, providers that we work with, as well as internally on the county system side. But it starts with an intake. We do that in-home assessment. We develop a care plan based on their unique needs of each caregiver, so we can kind of tailor it to their specific needs. We have a committee that approves an award amount. That amount is kind of an average of the area cost, with consideration to the number of participants on the program, as well as our grant amounts and the given need for services at one time. All of that's recorded in our state data system. We have a special voucher processing system that helps us to generate those vouchers and mail them to the client. But essentially a caregiver is able to hire a provider of their choice, fill out the voucher form as the record of service, submit that to us, and then we're able to reimburse that check directly to the caregiver. We are at this time accepting vouchers directly from a provider. So if an individual caregiver decides to work with a provider, they may, and we can accept the bill directly from them. So per our county processing rules, we are not required to obtain a W-9 form for caregivers themselves or an individual, but we are required to for the providers. Caregivers are eligible to receive 2 awards each year. So each one's good for 6 months. We can go to the next slide. We kind of talked about that. So with our voucher program, because it's consumer directed, it empowers the caregiver. It gives the caregiver that control or that ability to hire their provider of choice. It's culturally sensitive. It can be adjusted to any cultural need, and it provides an opportunity for each caregiver to work through their natural support lines. It's person-centered. We've noticed that sometimes caregivers are resistive to care coming in, and we found that this consumer-directed program sometimes eases the idea of accepting their help in their home, and makes in-home care a little bit more familiar on an occasional type basis. It's flexible to any type of environment. We touched kind of on those frontier areas, but to give you some perspective, the frontier areas in Weld County are very rural, meaning there aren't services locally for miles. And one is the area that this individual lived in. They were farmers, and the caregiver was over 80 years old, but wanted to continue farming. They found joy in that and life satisfaction. And we were able to provide the consumer-directed approach. So they were able to hire somebody locally, meaning like a neighbor, to come over and help that individual with their loved one's care so that they could continue working on their family farm and have that satisfaction, as well as know that the loved one is being cared for. So that's kind of one success story of how it can kind of work in that frontier or rural type of environment. And of course, this model can be adapted across any type of lifespan. And our surveys each year average about 93% satisfaction for the caregivers to increase their feelings of being able to care for their loved one. So that is kind of how our program works and how we function here with our caregiver respite program.
Thank you, Jillian. We're gonna move on to Cheryl Dinnell.
Hello, my name is Cheryl Dinnell. I represent the Nevada Lifespan Respite Care Coalition and was also the project coordinator on the Respite RX pilot program, where we developed a consumer-directed respite voucher. I have a few slides. Respite RX was allowed to be creative in designing respite to alleviate some of the barriers that came with our voucher programs. Plus, we recognized that a $500 or $1,000 voucher each year was not sufficient support for family caregivers. Can you find my slides? Okay. Our goal was to give family caregivers 2 to 4 hours a week on average. And so hopefully she can get some slides up there. There we are. I wanted to share a couple of slides from our consumer-directed voucher program. And this first one's our Respite RX funnel. So in existing voucher programs, we had significant drop-offs in participation, and funding allocated was unspent, and no one really knew why. We knew that respite was a need, but there was obviously barriers to respite that stood in the way. And to learn why these barriers were occurring, we built this funnel to help us see this journey to respite. If people were dropping out from one step to another, we wanted to capture why. A person-centered consumer-directed approach allowed us to work closely with our families to identify their sticking points and to see what we could do to clear the path forward. Next slide, please. This is our exit data. So as we follow these families along, death claimed a lot of our care recipients, or placements were needed, meaning we were getting family caregivers right at the end of their caregiving careers. Sometimes respite service did not facilitate respite either. This service couldn't do medications, that service wasn't allowed anything hands-on, etc. So because the long-term social service system is Medicaid or regulation driven, even other service types could not adequately replace family caregivers long enough to give them a beneficial break from care. And our family caregivers were given the ability to negotiate employment terms with the respite workers directly so they could get the respite that they needed. If unpaid family caregivers are good enough to provide care at home, surely they could be temporarily relieved of care by someone good enough to step in. We also learned that it takes a long time to get a caregiver to respite when they are finally ready to accept it. The paperwork trail, finding the right provider, the time it took to finally get to respite caused too much stress for some caregivers, especially when they couldn't yet tell what benefit respite would be for them. Next slide. Lastly, this slide shows just how well our program held up during the COVID shutdowns. 48% had no impact to their respite services because they hired friends, family, community members who served really only them. They could institute their own protocols for safe care and not be waiting months for regulated agencies to be given the permission to resume services. So that'll be a little introduction to our program.
Okay. Thank you, Cheryl. Appreciate that. Next, we're going to introduce Kent Mathews.
Hi, my name's Kent Mathews, and I oversee the Family Caregiver Support Center here at the Pikes Peak Area Agency on Aging. The Pikes Peak Area Agency on Aging serves the 3-county area of El Paso, Teller, and Park counties. Basically, El Paso County is more of an urban county. Teller County Teller County is more of a combination because of Woodland Park suburb type county, as well as rural county, and Park County is one of the most rural counties in the state of Colorado. The voucher program that I'm going to be talking about is for El Paso County only because Teller County and Park counties have their own voucher programs, which I cannot speak to because I do not oversee those. The Teller Senior Coalition oversees the caregiver voucher program in Teller County, and the Park County Senior Coalition oversees their voucher program in Park County. Basically, for our program, we have 2 types of vouchers. One is a in-home voucher, and the other is a daycare voucher. On the in-home voucher, the respite care is provided in the home by a licensed home care company. We pay for 12 hours of time during the time of the voucher, and the vouchers can be used anytime, daytime hours, evening hours, or on the weekends. We also have 2 types of care in the home, homemaker companion, and then also personal care. The daycare voucher, we have the respite is provided in an approved daycare. We cover 32 hours of care we pay for 32 hours of care in the daycare in blocks of 4 hours or 8 half days. And those vouchers can only be used during the operation of the daycare center. How the program works is the family caregiver is qualified to receive a voucher through I or my staff. I have one staff person who works with me. We qualify them for a voucher. Once the caregiver is qualified, they inform us the type of voucher that they want. Do they want to use a daycare voucher? Do they want to use a home care voucher? They also then provide us with the name of the provider they want to use and the date they would like the voucher to start. Once we know that, we produce the voucher. We email a copy to the family caregiver provider, and then the family caregiver contacts the respite provider and arranges with them the days and the hours that they are to be used under the voucher. We provide the family caregivers with a list of the providers for them to choose from. We emphasize with the family caregiver that the respite voucher is not a monthly voucher. The first voucher they get immediately when they tell us the name of the provider and the start date. Then we issue that voucher, and then we put their name on a rotation list. And in about 2 months, when we get
Yeah,
your
I'll
name
do
on the
that,
rotation list, we contact them for
invites.
details about the second voucher.
So sorry, Kent, would you mind hanging on for just a second? Hey,
Sure.
Jason, we can hear you ordering your Starbucks. Sorry, I had to say it.
Okay.
Sorry, Kent, for the interruption. We've all been there,
No
multitasking.
problem. So the, the initial voucher is immediate. When the caregiver gives us the information we need to produce the voucher, we issue that immediately. And then they wait a couple of months for the second voucher, wait a couple of months for the third voucher, wait a couple of months for the fourth voucher. We also stress with the caregivers that the Area Agency on Aging will only pay for the hours listed on the voucher. They can go over those hours, but we will not pay for them, and the agency they're using will then bill them at their private rate for any hours over. The length of time for the voucher varies on when the voucher starts. If the voucher starts anywhere on or between the 1st to the 10th of the month, the voucher ends that month. So if the voucher starts May 1st, May 4th, May 10th, the voucher ends May 31st. If the voucher starts anywhere on or between the 11th through the end of the month, like May 11th, May 18th, May 29th, May 31st, the voucher ends June 30th. The reason we have that range is because it helps us when we contact the caregivers on the waiting list when they want the voucher to start. Because sometimes they may not know if they really want a voucher, but if we give them an increased range, they're more likely to want to say, yes, I'll take a renewal voucher. Some additional information is that if family caregivers have questions or concerns, we encourage them to work with the care planner, either myself or Jennifer, who initiated them with the respite voucher program. If the caregiver has complaints about the service being provided, we want to know about the complaints, but the caregiver also needs to make those complaints to the home care agency or to the daycare. We will not do that on behalf of the caregiver. Voucher hours that are not used by the family caregiver cannot be banked or carried over to the next voucher requested by the family caregiver. So any unused hours go back into the bank for other caregivers to use. Family caregivers can change the type of voucher that they want or the provider that they want to use in between vouchers. Once hours have been used off of the voucher, we can't make changes. But if the voucher has not been used and they want to use a different type of voucher, like go from home care to daycare, we can do that. Or if they want to change providers, we can reissue vouchers by changing the provider. And respite services cannot be started until the home care agency or the daycare has completed their assessments so they can provide the services. Qualifications for our respite vouchers, either the caregiver or the care receiver needs to be 60 or older, and the care receiver needs to be dependent in at least 2 of the 6 activities of daily living. We do have disqualifiers from the voucher program. One of the disqualifiers is if the care receiver starts receiving services from the VA aid and attendance program, or another like veteran in charge program or other VA program that provides care in the home, we will not issue any more vouchers. If the care receiver has a long-term care policy that is paying for care in the home, which means they're out of the exclusion period, we will not issue any more vouchers. If the care receiver is receiving HCBS services in the home for Medicaid long-term care, or they're on the IHSS program, we will not issue vouchers. If the care receiver is on hospice care, we won't issue vouchers. And if the care receiver is no longer dependent in 2 of the 6 activities of daily living, we won't issue vouchers. So those are the disqualifiers. That's basically our program.
Well, thank you very much, Kent. I'm going to move to Lita Nelson from Arizona.
Good morning, everyone. My name is Lita Nelson. I work with the Arizona Division of Aging and Adult Services with the Department of Economic Security. I am based in Phoenix, Arizona, and how our program runs as far as the lifespan respite program, it's similar to many of the programs you've heard already. For us, for the compensation, how do we determine the amount of the voucher? The respite voucher program authorizes $300 for every 3 months. And the best practices for the past 5 years has been, the $300 for 3 months. And that is in alignment with most other states as they had started their startup for, the lifespan respite program. The compensation to the respite provider is up to the caregiver. And since it is a consumer directed model, the caregiver has much of the say in who they choose as a provider and how much they're reimbursing. And of course, that's also based on receipts. The minimum wage was $15 for the friends and neighbors. That is comparable throughout the state of Arizona now. Many of the areas of Arizona have increased their minimum wage up to about $15, with some areas at $12. We have resorted to choosing $15 as the friends and neighbors or the consumer directed model. And then the cap is $25 per hour. And that is more on the ADHD side, where they're in placement for a short number of hours where they receive the respite services. For professional providers, there's no limit. There's no cap to how much a caregiver may spend. And this is just to know that, if there's specialized help that is needed for that individual. Next slide, please. And so to actually issue payment, we do have to have a paper trail. When a family caregiver is onboarded, they are given information about what is needed to apply for the reimbursement. So we'll need an ID from both the caregiver and the care receiver, the caregiver stress assessment. In the state of Arizona, the AAAs and this program utilize the caregiver assessment tool, or the CAT. We also issue an authorization letter that is also for the voucher program, so the caregiver can help, work on onboarding their respite provider of choice. We also provide a timesheet where we track the days times the cost per hour and the total amount paid, and it is signed off by the caregiver and the respite provider, and a copy of the provider's ID if this provider is, someone that the caregiver has hired on their own accord. And if a professional or an agency is used, we'll accept the invoice on a company letterhead indicating that it has been paid. Next slide. And so this is a little bit of a payment cycle that we have going on. You can see that the family caregiver initiates an application. The Caregiver Coalition keeps the file for reauthorization. In the state of Arizona, we have a statewide database, which is utilized by both the Lifespan Respite Program and then also by the area agencies on aging. So we can, screen the caregiver to make sure that there are no other existing respite care services that are funded by the Older Americans Act. For the caregiver assessment, it is completed by phone, and they use the short form for this particular assessment. And for the payment, we do have to have the timesheet, the ID, and those are all matched with receipts and time of care and all of that for the family caregiver. And the reimbursement is sent out within the same week. And if the family caregiver is only authorized for the $300 in the 3 months, they can request for the other $299 within that same time period, or they can move out their authorization if more time is needed to use that funding. The caregiver, it's up to them if they would like to have the tax form a 1099. So we really spend a lot of time educating them on the $600 threshold, above or below, what the tax implications for that looks like. So it is up to them. They acknowledge if they would like to exceed that amount, then they know they'll get a tax form at the end of the year. And for emergency respite, the entire $600 or $599 is authorized right off the bat. So there is no need to have them come back and forth with us if it's a true emergency situation. Next slide. As mentioned, if taxes are an issue for the caregiver, then they'll know to stay under the $599. And if they're okay and they acknowledge the fact that they'll be receiving a tax form, then we can exceed the $600 threshold. There is right now work with the Arizona Caregiver Coalition. They've been testing a procedure where the caregiver is providing a W-9 upfront, and that'll allow for an increased authorization of up to about $1,200 per year. And that's about roughly $300 per quarter, depending on expenditures. Next slide. For the cultural competence issue, we really focus on the fact that this is consumer directed. So the caregiver has the say in who they choose as their provider, who they're onboarding, who they're reimbursing. And of course, we try to incorporate families, their natural supports, who are they in their own communities that are able to assist them. And many of them include friends, family members not living in the same home and that are not immediate family, like spouses or children. And then families also decide when and where to have the respite provided. It can be out in the community, can be, in a facility for short stays, adult day health clubs, what have you. So they do have that as an option. And as far as speaking also to cultural competence, there are, Spanish language versions of, the information that is provided. And we also do outreach to tribal communities as well and work with them on, making sure that this plan or this option is available statewide and to a number of different demographics. Next slide. So how do we address waivers? We do ask caregivers to sign off on the application to screen and train the respite provider. Of course, this is all due with our guidance, our assistance, our forms, our we kind of walk them through the step-by-step on how to choose someone, if that choice is appropriate, and how to respond if it is not an appropriate decision. They are responsible for selecting the provider with all of that knowledge, with all of the training, with all of the guidance. Then they'll decide on which provider they'll go with. And then the Arizona Caregiver Coalition and us ensure that we do follow up and just make sure that the caregiver is, providing and receiving, and their care recipient is also receiving adequate services as well for respite care. And this is our contact information for any other questions or further clarification on anything. So myself and Yuta Oilik with the Arizona Caregiver Coalition, we're always happy to help and talk to people about how to set up programs and things like that. So thank you very much.
Thank you, Lita. Appreciate that. We're going to move to Anya Taylor, who is with Easterseals, Delaware, and in Maryland's Eastern Shore.
Thank you. Hi, everybody. My name is Anya Taylor, and I am the outreach assistant for the community outreach program here at Easterseals, Delaware, and Maryland's Eastern Shore. I've been with Easterseals for almost 4 years this September. I do many things in COP, but I play a rather large role in our respite voucher programs. We in the community outreach program are passionate about family caregivers and providing them with resources and information to help them in their caregiving journey. And one of the ways that we do that is by our respite voucher programs. Just to give you a little bit of history of the program, in the early 2000s, a survey was conducted and the need for a respite program in Delaware was confirmed. So subsequently, a coalition was formed with Easterseals as the lead agency, and the coalition developed the structure for the respite voucher system. The program was initially started as a pilot with funding from 3 local foundations. As the foundation funding ended, the State of Division of Services for Aging and Adults with Physical Disabilities, DSAPID, applied for and received federal lifespan respite funding to sustain the program. And now the lifespan respite program is a line item in the state's budget. Throughout the life of the program, Easterseals has been the lead agency to develop and manage the voucher program. Additionally, as a result of the lifespan respite program, Easterseals was able to secure funding through the System of Care grant with the State Division of Prevention and Behavioral Health Services for a respite voucher program, and we hope that that will follow the same path as the lifespan respite funding. So to give a little bit about how our program works, it does work similarly to some of the programs that we've already heard. So our program services the entire state of Delaware, and across the 3 programs, we serve all caregivers and care recipients across the lifespan, no matter the diagnosis. Each voucher program has different eligibility requirements, and the programs are completely consumer directed. So our caregivers get to choose who they would like to have care for their loved ones so that they get a break, as long as the provider meets our requirements. The nice thing is that this really allows for respite to be completely spontaneous, whereas other programs in Delaware, respite has to be a little bit more planned out. It also gives caregivers the freedom to choose what respite looks like for them. The grant is awarded once a grant year, and if they don't use it, they lose it. It can't be carried over to the next grant year, but they're more than welcome to apply again. Most commonly, we reimburse the caregiver directly. However, we can also pay the respite provider, whether that be someone that they know, agencies, summer camp, day program, etc., directly. So once the caregiver has respite, the caregiver and respite provider fill out an invoice after the respite has occurred, and the invoice they receive in their approval packets, and then they'll send it to us. Then what we do, as long as we have the documentation that we require, we complete a brief follow-up survey with each provider, and then we send it up for reimbursement. The process is slightly different if we're paying an agency, day program, or summer camp directly. But over the course of my time with the program, hearing the way that caregivers have been able to get breaks has been inspiring and heartwarming, while also seeing how creative caregivers can get when they have that freedom has been amazing as well. This has also motivated us in COP to be creative in providing them with respite services. So we recognize that for some families, they need more than just funding. So we are currently in the works of figuring out ways to add a menu of respite options to our current program while still keeping the respite vouchers as the core. And that is all I have. So thank you, and I look forward to the discussion.
Thank you so much, Anya. So we're gonna move on to the group question portion. The first question today is for Kent Mathews, and the question is, when setting up the Pikes Peak Area Agency on Aging's respite program, how did you decide to run your vouchers through provider agencies only? What did you take into consideration? And that's 5 minutes, please.
So the easy answer to that question is, well, for one, our voucher program began in April of 2009. So it's like 13 years old. And at that time, my director told me that he wanted the voucher program to be, he wanted the respite program to be consumer choice. Those were his words, but that we could not use private individuals. we had to use home care agencies. So that was the simple answer. It was under the direction of my director. When we put the voucher program together, I pulled together a team. It consisted of, I believe there were three people on the team were owners of home care companies. One was the director of an adult daycare, and then we had 2 volunteers. And we spent about 4 to 5 months talking about and in visualizing the voucher program and how it would work. And what we wanted the voucher program to be was flexible, have easy communication. We wanted a program that would empower the caregiver rather than enable the caregiver. And we wanted a program that, when set up, and once the community began to know about it, would give home care agencies the opportunity to tell their clients who fit the profile about the voucher program, so that they could then come to the Family Caregiver Support Center for caregiver consultation and then getting qualified for the voucher program. So that's basically why we did what we did and how we put it all together.
Thank you very much, Kent. The second question is for Cheryl. And the question is, why did Nevada decide to pursue a consumer-directed voucher program? And what issues were you trying to address?
Okay, our grant was written to get respite to unserved or underserved family caregivers, particularly in rural Nevada. If we could get a program to work in rural Nevada, we could get it to work anywhere. These were our gap families, not being served by existing respite programs, sometimes due to eligibility criteria, age, income, diagnosis, whatever, the family didn't fit. Maybe they had both children and elders in the home and needed those covered for respite, or more than one care recipient or other complication. These barriers were removed to make all caregivers everywhere in the state eligible for respite. Most of our long-term social service system is funded through provider agencies, but we don't have providers everywhere, especially in rural Nevada. So families needed a way to pay respite workers who were not provider agency employees. Because of tax liability and other reasons, we did that through a fiscal management or payroll service that made family caregivers the employers of record and enrolled their hired respite workers, or the vendor agencies if chosen, into that system so that timesheets or invoices were paid and the state agency could be billed for the respite expenses. We also wanted to know more about what respite needed to look like for family caregivers. Some families, an outsider agency provided worker was never going to be acceptable. Through a person-centered respite design process, families told us what it would take for them to feel comfortable using respite. Surprisingly, well-trained workers were not what caregivers sought. Family caregivers told us if they could provide adequate care, they could train someone else to provide that good enough level of care too. Family caregivers also told us they needed scheduling flexibility to hire workers for when respite would best fit into their lives. Now that was usually when care needs were minimal, because that's when they could more easily take a break. But they also needed backup respite workers or providers when like one hire wasn't available. So we allowed caregivers to select 2 respite workers or providers and schedule respite between them as needed so that the respite sessions could meet the unique needs of their family. Maybe they needed somebody in the evening for date night and someone else in the morning for an exercise class, or to put a couple of workers on a rotating shift so they could get a mini vacation or whatever. So this choice, control, and flexibility on how to receive respite requires really consumer direction. Too often we heard that respite sessions weren't timed long enough to get to and see a movie, or that there wasn't really anywhere to go during that time. So a family caregiver would just sit in the car waiting until it was time to pick up their loved one. So respite was too often also wasted time, and we wanted caregivers to benefit from respite. That meant that they received freedom and support and the connections they needed for self-care, to preserve relationships and associations that were meaningful to them, and feel like that had someone pulling from them. And we didn't even know yet what COVID would do to them and the huge mental health challenges everyone would experience. So respite time is precious, and we wanted it to have an impact. Through a consumer-directed planning, family caregivers told us what they were missing in their life. A chance to take a night course, or to coach Little League, or just to get outside for sunshine and fresh air. Time for them to do something that was important to them. And respite programs were so focused on the care of the care recipients that little or no time was devoted to making sure that caregivers came back refreshed or rejuvenated during that respite time. Actually, family caregivers were shocked and amazed that we even asked about them. So thinking about family caregivers, they are the bedrock foundation of our long-term service, social service system. And if they fail, it's because we failed them.
Thank you so much, Cheryl. The third question is for the group of each of you will have a time for 4-minute response. So let's talk compensation. How do you determine the amount of the voucher or the level of compensation to the respite provider? Who gets paid, the caregiver or the respite provider? And what documentation is required and from whom prior to payment? And what, if anything, do you do about taxable income?
We'll start with Lita.
And, pardon?
We'll start with Lita.
Oh, would like to start with Lita.
Good morning again. So for the payment, we had mentioned, or I had mentioned earlier that we determine the amount that is reimbursed within the minimum wage standards in Arizona, and that's been on an average. So there are areas where we have $12 per hour as a minimum wage, and we have other areas where it's $15. So we went with the higher amount. We have opted to pay the $15 per hour for the lifespan respite grant. And this is to be competitive with other providers in the area, and then also bring family caregivers and their friends and loved ones that are offering this service at a comparable compensation, rather than something that is much lower. We didn't want them to think that we didn't value them as much as we did other professional providers. We know that with respite care, there are many different staffing issues. There's capacity issues, not just on the side of respite providers, but also for people that contract with those providers. So when we're talking about level of compensation, we're really looking at the broad picture of, what would work best for a family caregiver, what would work best for someone that may be looking for some extra income, and then what might be comparable to what's already available. So we have people that may be interested in helping family caregivers, on a kind of choose your own schedule type of basis versus, trying to look for work where there's, capacity issues as it is. And then with the adult day centers in Arizona, we have a handful of adult day centers right now that are contracted with the area agencies on aging. Now we're looking at other options such as, unlicensed daycare centers or day clubs or memory cafe model type of respite care options. When we're looking at level of compensation for that, we also want to be comparable to other standing ADHCs in the state. So we went with $25 as the maximum reimbursement for that. And where we do have a relationship with the area agencies on aging, where the Arizona Caregiver Coalition will authorize the ADHC funding, and that funding is filtered through the area agencies on aging. So it's a direct payment under contract with that provider. And that leaves the caregiver not having to pay out of pocket. It comes from the AAAs at that point for the adult daycare services. Now we have 3 different providers for that, 3 different counties that participate. Unfortunately, adult day health centers are not readily available in more rural areas of Arizona. So we do look at the other voucher program as an option for that. And when this is not the model, it would be the family caregiver that is receiving the reimbursement check or the payment back. And those are based on invoices or receipts, time cards, all of those have to check out. And we do ask the caregiver, to report how things are going with the respite provider, and this is also, of course, with the built-in, if a family caregiver is using their built-in supports, their natural support system, don't want to cause any kind of rift if there are issues. So how do we address those from the get-go rather than letting it, become an issue? So we do check in on caregivers periodically. And so they know that there are standards from the caregiver and standards from us for the care. For the taxable income, the caregiver has the choice. They know that the amount is $600. And if they're going to receive a tax form, they're well informed of it. And it is their choice to know and accept that the fact that there would be a tax form being received. It's not a surprise at the end of the year, oh, here's a 1099. Good luck with your taxes. It's something that is upfront. And it's always something that we discuss with them. A lot of this is included in the onboarding process. Thank you.
So for us, with our voucher program, how we determine, it depends on the type of voucher. For the home care vouchers, we periodically survey the home care agencies that are providing the respite to get an idea of what their private pay rate is. And then we use that to set our reimbursement. When we set our reimbursement, we do not want to make it so low that they're not willing to participate, but we don't want to equal their private pay. And so we always shoot for a goal that's a little bit under, but still very workable for them to, especially if they want to maintain volume, for them to not have their participation in the program become so much of a financial burden that they decide not to participate. For the daycare voucher, that rate is determined. The one daycare that's still participating has a contract with Medicaid long-term care, and their contractual agreement with Medicaid long-term care says that any other contractual agreement they enter into to pay for daycare services cannot be any lower or higher than what Medicaid reimburses. So that determines the rate that we pay the adult daycare for the respite voucher.
Thank you, Kent. We're going to move on to Jillian, please.
Yeah, I just want to say ours is slightly different in the sense that we don't set a rate per hour for respite services, but rather a monetary amount for a voucher period of 6 months. So we set that rate or that grant amount based on the average cost for care locally. In recent years, we've been able to increase that award amount slightly to kind of account for those increased care costs. But we recognize at some point that funding cliff could happen and we might not be able to account for that increase, but we try to kind of be as fair as equitable as possible, allowing that individual to pay a provider or pay that informal respite person, accounting for what the kind of going rate is with a certain number of hours each month. So that monetary amount, if they spread it over the 6 months, is kind of how we look at it. We pay the caregiver directly, or we can pay just an agency. We currently do not pay any private providers, and that's per county policy more so than anything. And we do not track this per our county policies. We are not allowed to track that for taxable income because it's replacing the service. They've already purchased that service, and we are simply reimbursing them for that service that they've already paid for. So they don't gain anything from it. So no one receives a 1099 at the end of the year.
Thank you, Jillian. I'm going to ask Anya to go next, please.
Thanks. So our program actually works more similarly towards Jillian's. So we don't have a required amount that a caregiver needs to pay a provider. When I speak to caregivers, I tell them it's really what they're comfortable with and what the respite provider is comfortable with. I would say on average, I see invoices for anywhere from $10 to $25 an hour. It really just depends on the level of care and again, what they're comfortable with. So we can either reimburse the caregiver directly, and with that, there is no taxes there. I do tell caregivers and respite providers that if they have questions, they should go talk to a tax professional, since I'm not one, but because it is a reimbursement, we don't issue out tax forms. But if we pay the respite provider directly, at that point, it is considered income. And at the end of the year, they do get a 1099. So we have them fill out just a different piece of paperwork so that we're able to do that. We need, in order to reimburse or make any type of payment, we need medical documentation notate that confirms the loved one's diagnosis if there is one. We actually need that in order for the application to even be processed. But for the invoice, we need a copy of the respite provider's ID to make sure that they meet our requirements, which is they have to be above the age of 18 and they cannot live in the same home as the care recipient. And then we need a completed direct deposit form. But then what we do on our side is we complete a brief follow-up survey with the provider. And that's just to confirm really that care was provided, they were paid, because that is an important part in that regard since it's a reimbursement. And then we send it up to the business office, as long as we have all those ducks in a row beforehand. So.
Thank you so much, Anya. Finally, we'll ask Cheryl to speak.
All right. Well, now sufficient respite was another goal. So we took research by Dr. Delaware on effective respite to heart and determined that 2 to 4 hours of respite per week on average would be our goal. And so we kind of went with a guesstimate of $15 an hour as the average cost for respite. That allowed us to determine that each family needed about $3,696 a year to receive adequate respite. With the funds we had, that meant we could serve 65 families in our pilot program. Remember, these are the gap families that could not be served anywhere else. So we contracted with an FMS payroll service. They charged $42 a month per family caregiver, plus $22 per background check. And so that gave us $308 a month available for respite costs. The family caregiver negotiated the rate of pay with their workers. We did not set rates. They were good stewards of these funds because the lower the rate they could negotiate, the more hours of respite they could schedule. Obviously, our provider agencies charge more per hour, and if a family caregiver choose one of those, then they would get fewer hours of respite per month. But our average guesstimate of $15 an hour proved to be spot on. And we also reached our goal of providing 2 to 4 hours of respite on average per week. And we didn't have to control everything to make that happen. The money was never given to the family caregiver, so there was no tax liability to worry about. The employee, was the only one with taxable income. The FMS service paid the timesheet signed by both the respite worker and the caregiver, which were submitted electronically in the FMS payroll cycle. employer paid taxes and employee withholding were handled by the FMS, with pay for the respite worker directly deposited, either to their bank account or to a charge card. And then of course the employees received a W-2 at the end of the year, and that's how we handled it.
Thank you, Cheryl. I'm going to move on to the next question. This is for Lita, Jillian, and Anya, and you each have 3 minutes. I'll start with Lita. How has your programming addressed cultural sensitivity in providing respite care?
Thank you. When we were looking at cultural sensitivity in the state of Arizona, we are home to 22 tribal entities, and we are also pretty much the melting pot for retirees of all, backgrounds and cultures. So our challenge has truly been, how do we outreach to those individuals that need assistance and services, and this is just older adult services across the board. So for non-medical home and community-based services, it has been a challenge to successfully complete outreach. So with tribal nations, we can't just go on tribal nations and say, here's a program, this is how we can help. You have to go through leadership, you have to go through council, you have to go through executives and sign off on many different forms because they don't want individuals coming in to just, collect data, even if it's just outcome information on how, respite care services were utilized and if it was an effective program for the family. So being really careful with that, those are still relationships that are being built, meetings that are happening. But since the program is available statewide, we also have the Spanish language component to where individuals are able to access that information. There are Spanish speaking or bilingual staff that are able to assist with questions, with the packets, with the guidance, and anything else that may be needed. We are looking at more comprehensive gaps in services with the area agencies on aging when it comes to cultural, demographics and more cultural competency. And we really rely on the AAAs to help us to, kind of gauge how and when and where we need to address certain, demographics. And with that being said, we have a high, number of refugees that are, within the state of Arizona. We do also consider the rural nature of Arizona, that, they're not going to have, strangers come into their homes. They'd rather have friends or neighbors because, they have learned to function that way and they utilize their own resources. So they've become very resourceful and caring for their communities. And in many ways, we try to capitalize on that, if you will. We try to reach out with partnership opportunities and talk to them about what respite is and how some money can come flowing back to the community if that's and that is a huge need because a lot of our more outlying areas are very the socioeconomics are not what they are in terms of more urban areas. So when it comes to respite care services, we try to offer them a partnership first, and then secondly, that there is some potential for income. And thirdly, we want to respect the cultural, sensitivities and make sure that we're competent when we're talking to certain demographics rather than just here, this program is available and we can pay you for it, but more appropriate communications and outreach at that point. So thank you.
Thank you, Lita. Jillian, would you like to go next?
I would just kind of ditto what Lita said there. Our program, I think, can be very culturally sensitive, and that, in fact, that's very important for us, considering the diverseness of our county. We have many different pockets where it is difficult for some families to accept services. And the consumer directed model really works because it can be flexible and adjust to any need that exists. And we, kind of like Lita said, are constantly reevaluating. Are we meeting those pockets? Are we doing the correct outreach there? We have an outreach coordinator whose sole purpose is to connect with some of those kind of pockets, and we do try to bring those services. And the only other piece I would like to touch on is that I think it's really important initially when we do our in-home assessment, meeting them in their home and learning about some of the important things that their family values are, I think is very important.
Thank you, Jillian. Let's see. Anya, would you care to go next, please?
Yeah, so basically the same for us. I will agree. I think with it being consumer directed and the family caregiver getting to choose who they want and also who they're comfortable with coming into the home and caring for their loved one, kind of meets that need. We also are working constantly on how to fill the gaps that are there with us trying to reach different demographics and different cultures within Delaware. One of the things that we've been working on is trying to go to different faith-based organizations. And a lot of that is you have to, meet with leadership and have those conversations. And I found that word of mouth also helps. So, a caregiver might have a great experience with us and they tell, their family, their friends, and that also kind of helps segue those conversations. I do a lot of the applications over the phone, and I have found that also kind of helps just learn more about the family. Like Jillian said, we don't do home visits, but with the application, it just helps to kind of learn more about the caregiver and their situation, because we also have case managers on staff who can help caregivers find different respite options or really anything that they need within the community. And having those initial conversations with the caregiver, I think, helps us be able to provide great services. So thank you.
Thank you, Anya. So the last question is for Lita, Jillian, Anya, and Cheryl. And you each have 4 minutes. The question is, how do you address indemnification waivers and background checks? Do you want to just keep talking, Anya?
Yeah, I can start. So we don't actually do anything with background checks, again, with it being consumer directed and the caregiver being able to pick who they want. I always stress, and everyone in the community outreach program, when they talk to caregivers, to do their due diligence in picking somebody. So if it's somebody that they don't know, we can always provide them with like resources to do how to do background checks or what questions to ask. So we stress that whenever we talk to our caregivers. But with it being consumer directed, we don't have to worry about the background check aspect of it. Now, in regards to the waivers and the indemnification, so for us, what we do is on the application and on the invoice, which the caregiver and the respite provider have to sign, we basically put a few things in there saying that this is really in their court. We don't accept any liability because it's the caregiver choosing to have the person provide the care, and it's the person choosing to provide the care. But they have to sign off on it and they have to date it in order for us to even process anything. And I think that kind of helps. And again, I have a very open door policy. So if there's any questions that the caregivers or even the respite providers may have when they're filling out the paperwork, I always tell them that they can call or email me, and I have no problem sitting and spending time with them going over different things. But I will say that we don't really have to worry about that. It hasn't become an issue, thankfully, and hopefully it won't, but that's kind of how we handle it.
Megan, you're still on mute. And you still are, sorry.
Okay, I'm not sure what's going on. Anyway, I apologize. Lita, would you like to go next? Can't you read my lips?
Can you hear me now?
Yeah. Yeah.
So yes, for the background checks and making sure that, waivers are in place, we do, in the course of the onboarding, we do ask caregivers that, when they are participating in this program, that we know that, there are some issues that we may have to address at some point along the way. So we're very truthful in terms of, this program is not always going to be 100% what you want or expect. There might be some hurdles we have to go through, but we are there with you. Now, in the application itself, we do ask that they do screen and train respite providers. So in terms of how that, comes out with between the caregiver and the provider is we offer caregivers, what is, what are maybe some signs that this person is a good fit for your loved one? Does your loved one know this person? Do they have a good relationship? Do you trust this person? Have you asked this person before to, work with your loved one and to stay with your loved one? And a lot of the ways and a lot of the times there is, already a trust relationship that has been built and the loved one is familiar with this person. So the caregiver is actually sometimes a little bit uncomfortable with asking for a background check at that point. But that's also still an option for them. When it comes to the adult day health centers or day clubs or other community types of respite care services, we do ask the caregiver to do a surprise visit, to kind of get an idea of what they serve, how they interact with their clients. Do other people that are utilizing the service look like, they enjoy being there, just everything that we can kind of give them to give them appropriate, senses of what, a respite provider might offer to their loved one. And if they're able to be, away from their loved one for any amount of time that, they're not constantly worried, that, they're not constantly thinking what's going on, what's happening. They actually have someone that they can trust taking care of their loved one. And then also, of course, we do have waivers and we do have the caregiver sign off saying that, the Arizona Caregiver Coalition and the state agency are not liable for anything that may happen during the course of the respite services. So caregivers are really careful and they become really choosy when it comes to who they're selecting as a provider. And once again, we are with them throughout the whole process and we haven't run into any issues that have been a major concern at all. If there are issues that are identified early on, we ask the caregivers to share that with us. So we kind of come up with a plan on how to address it. And a lot of times, it's at that point where it doesn't go further than that and they're able to address it. So once they come onto this program, we never want them to feel alone. We want to give them as much information and, resources in their tool belt when it comes to respite care services. Thank you.
Thank you, Lita. Cheryl, would you care to go next, please?
Okay. When we were first developing our Respite RX voucher, we received a lot of concern about this. In working with our state DAG office, we put a waiver clause in our application material, as well as several attestations that the caregiver understood and agreed to the program policies and procedures. Initially, we had a third-party verification system to protect against fraudulent claims of being a caregiver, where someone from a trusted source would verify their status as a primary caregiver. But it slowed our application and referral process down. And since the referrals were all coming through our ADRC system, for people already known in that system, the ADRC staff provided the verification and we could drop that cumbersome extra step. Since the money wasn't going to the caregiver directly, the motivation to make fraudulent claims to receive respite funding was mostly removed. Our fiscal management service, the payroll system that we use, also had protocols in place to handle claims when a respite worker wasn't paid or wasn't paid correctly. And the employer and employee paperwork also covered these aspects. Backgrounds were done by our FMS service if the caregiver requested it. So provider agencies, their employees, they handle their own. Family and friends might be sufficiently trusted. So it was requested typically when others in the community were hired. And so that's kind of how we handle some of these issues.
Thank you so much, Cheryl. Jillian, would you care to go next, please?
Sure. So ours is similar to Lita and Anya when they were talking. We just have the identification and the waivers included in our release of liability statement. We can't provide any respite services to an individual who does not agree to those terms. I have never seen that in 11 years become an issue. We release the county, the state, anybody of any liability when it comes to who they choose to hire because it's consumer directed. We also do not do background checks. We would encourage a caregiver if they were concerned to do that on their own or to work with like an agency that would provide that as a service already included with that respite option, meaning they provide their own background checks to their employees. Again, we've not really seen that become an issue, but it's really important that we have that signed each year from the caregiver. So it's good for each year. And then at the 6-month mark, we have them kind of verbally agree to that same release of liability statement.
Thank you, Jillian. I think we're going to move on to questions and answers. I guess if anyone has a question, if you want to put it in the chat or raise your hand, I will call on you. How much time do we have for this section?
15 minutes.
15 minutes. Okay. All right. So does anyone have any questions for our panelists
There
today?
was a question in the chat that went unanswered. Are there any programs focusing on LGBTQ and older adults or LGBTQ older adults and caregivers?
Okay. I don't know if everyone heard that. I'll trying to find it so I can read it
I'm
here.
already putting it in there.
Okay. Thank you, Erin. Oh, there it is. Are there any programs focusing on LGBTQ plus older adults and caregivers?
For the state of Arizona, when we're doing outreach, it's pretty much to all caregivers. We don't necessarily ask them or focus on things such as sexual orientation or certain areas, but that's not to say that that's also a disqualification. We do have individuals that have participated in the program that have identified as LGBTQ plus community members. So all in our programs, all caregivers are welcome regardless of any kind of diagnoses or anything like that. So if there's a need for caregivers, we definitely respond to that need regardless.
Thank you, Lita. Are there any more questions? Or if anyone else would like to respond?
I just have to agree. Lita stated it perfectly for our program as well.
Thank you, Kent. I'm not seeing any questions, so.
Yeah, the panelists can offer any last comments.
So since we don't have any questions coming up, do our panelists have any additional thoughts or things they would like to share with the group? Go ahead, Cheryl.
As far as the families that were coming into our program, I'll just add to the fact that we know we were serving families who had the LGBTQ kind of connotation. We didn't collect data on that, but we knew from working with so closely with those families that we were things that we have seen post-COVID is that caregivers are still advocating to put into place, receive all the services that the care recipient needs. And given our workforce shortages, those services have been kind of difficult to reestablish. And caregivers hate thinking about respite for themselves when their loved one is not receiving all that they need. So once again, they put themselves on the back burner. But so with the services that can be cobbled together, you would think that respite opportunities could still be created. But our system of services is inflexible, and the lines are drawn so to differentiate services by regulation, by providers and their liability insurers, to limit their risks and to carve out their own protections, which leaves family caregivers without much relief. And I really think every provider should have a greater responsibility to take care of our family caregivers who really do so much of the care in our long-term care system, social service system, by even encouraging short respite activities that could happen when these other services are provided. Maybe we even need to consider having a different rate paid when both a care recipient and a caregiver can benefit during that same time, and allow the service to stretch to meet both needs, maybe a service plus respite rate. But obviously that's going to be difficult to have happen if we don't have a consumer directed approach to begin with, to inform state agencies and policymakers on what really needs to change to make respite happen for caregivers. So that's just some of my final thoughts.
Megan, you're still on mute, sorry.
Thank you, Amy. I just wanted to say, does anyone else have any questions or anything else to add? If not, we'll probably take a break until 10:30, just and then we'll conduct Colorado business, and everyone is welcome to stay or whatever you would like to do. So,
It looks like he has something.
okay.
And we can sign off and you guys will let us back in.
So just stay on if you're staying.
Oh, you can just stay on. If you
Okay.
do need to sign off, I will let you back in though. Yes.
Okay, I just need to switch computers, so
Oh, sure. No problem.
thank you.
All right. I guess we're going to take a break till 10:30. Thank you, everyone.
Thank you.
Thank you.